Thank you. Good afternoon, everybody. I want to thank all of you all for coming out for this important occasion. We're going to talk about the infant mortality data, but we're also going to talk, I think even more importantly, about how we now are working to turn what I'll say is the final corner. We're going to talk today about the 2012 infant mortality rate. Infant mortality data often are well behind the reality. So in addition to 2012, which is a while ago now, we're going to talk about what the preliminary data looked like for 2013, because 2013 was over now 9 months ago. But you know, epidemiology and data analysis being what it is, it oftentimes lags behind some of the realities that we know, so they can be corroborated and verified. I want to thank Kelly for the work that she's doing with Community of Hope. We were here just a few months ago, not quite a year, I think, to cut the ribbon on this fantastic new clinic. You talk about neighborhood transformation. This is it right here. Look at this clinic. Look at the library next door, and look at what's going on across the street with Trinity Plaza. That is neighborhood transformation, and that is what we're seeing all across the District of Columbia at this stage, and what a shining example this is. You know, we're here at the Community of Hope today because we are obviously in Ward 8, and I think Ward 8 has the highest. I think it had the highest of any ward, the infant mortality rates of any in the city. Our infant mortality rate, the average, was 7.4 for 2011. It will go up, as I will announce, a little bit, slightly in 2012, and then it will come back down in 2013. But the initiative that we're launching now, officially launching today, is designed to be able to institutionalize the changes that we know are important to be able to ensure a continued drop in infant mortality. I want to thank the people who signed on with us to be a part of this. Aegis Health, the Clinton Global Initiative, which we were in New York last week to be able to talk about that, and we did, and we're really pleased that the Clinton Global Initiative has accepted this as a part of their arsenal of efforts to improve conditions not only in the nation but in the world. And other partners like Walmart. Nina's here with us today, and I want to thank Walmart for signing on as well to be a partner with us. And I think we have 40 partners, or we're working to get to 40, and some of those we're not quite ready to announce yet. In fact, Kaiser Permanente, which I'm a member of, is one of the partners that signed on. I want to thank a number of the community partners who are working with us as well. And I want to thank a couple of people, too, one of whom you will hear from. I want to thank our Deputy Mayor for Health and Human Services, who has done an absolutely extraordinary job. I've known Bibi Otero. She's been a professional colleague and a dear friend for a very long time. And when I came to take on this job, I reached out to her, and she agreed to come and do this. She'd never worked in government before, and really the responsibilities that she has are absolutely extraordinary in terms of their scope and the demands that are placed, you know, ranging from, you know, health care to human services to homelessness to child welfare to juvenile justice, and the whole range of things, the whole panoply of things that comprise the area of human services. So Bibi, thank you for the job that you are doing on behalf of the people of the District of Columbia. And you're going to hear from our outstanding Department of Health Director as well, Dr. Joxel Garcia. He was the one that really provided enormous leadership with the Clinton Global Initiative, and we're glad that that door has been opened. And we got to meet a lot of people in New York while we were there who we know those relationships will really facilitate our growth and development in this area. Some of you probably saw the CDC report that was released just I guess in the last week or so. It said that the U.S. infant mortality rate is 6.1, which is lower than ours, but is above many nations at this point. And I think we ranked 26th out of 29 nations that were measured in this look-see, if you will. It's really disheartening to know that a baby is three times as likely to die during their first year in the U.S. as Finland and Japan. And you can't tell me with a country that is as advanced as we are technologically and scientifically that we can't do better than that. And I know we can, and that's what we're working towards here in the city. We've made a lot of progress over the years. I was a DHS director, some of you may know, a number of years ago. And when I became the director, our infant mortality rate was 23.1 deaths per 1,000 live births, which is far worse than most, even third world countries. So we've come from 23.1 to where we are now, but we're still much too high. We're still higher than what we should be, and this is what we're trying to do with Stronger Together, to be able to institutionalize changes that will permanently make a difference in the lives of babies growing up here in the District of Columbia. Our infant mortality rate for 2012 went up slightly. We were at 7.4 in 2011, and we have gone up again to 7.9, a slight uptick for 2012. But the 2013 data are very encouraging. They have not been officially certified as yet, but we know how many babies died. We know what the rate translates into. And we had, I think, 69 babies that died in 2011. We had 75 who died in 2012, and we dropped to 61 in 2013, which will put the rate, the unofficial rate for 2013 at 6.6, which is still above the national average, and frankly should be the impetus for us to be able to do better, ladies and gentlemen. So that is our challenge that we face moving forward, and that's why we're excited to be able to announce today officially the Stronger Together, One City for Healthier Babies initiative that we think will help us turn the final corner in this quest to be able to ensure that babies grow up healthy. You know, to me, it is we focused a lot on early childhood education in this city, and that's exactly right. I think this is the front end of early childhood education, that if you get this right, it'll make infant and toddler services even more effective, and it will make pre-K3 and pre-K4 even more effective. It will make kindergarten more effective, and so on the continuum goes. And that's why this is so important, and so important to be able to help parents understand the things they can do and why it is important to be able to engage in the things that will be promoted as a part of the Stronger Together initiative. This initiative will focus on looking at how we continue to expand and grow our healthcare system in the District of Columbia, to be able to especially have effective prenatal care services like we have here at Community of Hope's clinic, and how we also address the social influences that impact good health. I mean, it's said, we've said it many times, all of us have said it, that infant mortality may be the best barometer we have of a nation's health and a city's health. So this initiative is designed to focus on that. Dr. Garcia will talk about the importance of getting into prenatal care during the first trimester, being able to ensure that prenatal care is continued throughout the 9-month period, and talk about smoking, which is amazing to see that there are still people who are pregnant that still smoke, which has a deleterious effect on the potential outcome of the pregnancy of that woman and that family. You know, we are working to have CVS sign on as a partner. That hasn't been consummated yet. But I want to congratulate CVS for having stopped selling cigarettes in their stores. That will have a major impact, we think. I hope we don't create an underground market for cigarette selling in the city. But, you know, I'd rather tackle that one than the people who are legitimately selling cigarettes. There are a number of pillars associated with the Stronger Together program to improve family capacity, to promote good health during the preconception period and beyond, being able to continue to strengthen prenatal care, ensuring quality care of newborns. And everybody, I assume, knows in this room that the definition of infant mortality is when a baby dies before becoming a year old. So there are things that happen to children during that period that may not have even been necessarily directly associated with the prenatal care or the preconception and conception period. For example, like co-sleeping, which we are working. We've had some babies who now have died as a result of parents sleeping with their babies. Now, you know a parent has to be devastated when something like that happens. But we're trying to now work with, you know, moms and dads to recognize the potential perils of that. And Dr. Garcia will talk about the carbon dioxide effects that emanate from that, as well as, frankly, something as seemingly obvious as a parent rolling over on the baby and suffocating the baby. And you know that that is, I mean, again, not to be redundant, but the awful emotional consequences that are associated with that for a parent have to be devastating and life-lasting, as I'm sure we appreciate. You're going to see a number of support groups that are being developed as a part of this effort, working on a scorecard that we will use to measure progress. And also there will be a social marketing campaign that will be launched and conducted as well to help improve people's understanding and information about why this is important. Bring him back. He's doing good. He's the best response we've gotten from the audience so far. Each time we make an important point, he says, yeah. You know, while we got these adults sitting out here with poker faces. And in any event, we're going to have several speakers. I'm going to mention all of them now. First of all, Dr. Garcia, who is our Director of Health, is going to delve more into the data and some of the specific initiatives associated with Stronger Together. Rebecca Brown, who is a new mom, is going to discuss the challenges associated with and the successes associated with prenatal care. Remy Shakir, who is with us in New York with the Clinton Global Initiative. She is with Aegis Health and Health Security, and will be working with us all along the way. Dr. Patricia Smith, who is an OBGYN with George Washington University, and Nina Albert, who is with Walmart and at one point worked with the District of Columbia government. So with that lineup of speakers, we should be out of here by tomorrow afternoon. So, Dr. Garcia, you're up. You're the man.
Good afternoon. If you were paying attention, you realize I only have one tie in my arsenal of ties. When I saw the video this morning, I said, oh my God, why I wear this tie today? Anyway, I have a brief presentation that I want to present to you in terms of PowerPoint. And like the mayor mentioned, we had, in 1991, we had over 20 deaths per 1,000 live births, and we have moved down to 7.9. The trend continues to go down, so that's the good thing. Like the mayor mentioned before, we have the preliminary data which suggests that we have 6.6 for the year 2013. For all the industrial countries, the average is 5.0. The CDC report and the mayor just mentioned that we are at 6.15 as a nation. And so there's a lot of work that we have to do. When we look at the rates in the nation, I would say that these are the aspects that are significantly important. Early prenatal care mayor mentioned before, what people do not realize, and Dr. Mitchell is here, who has been a great partner for us, it's that when we sleep with a baby, there's an interaction in between what we expel when we breathe out, and that CO2 affects the baby. The more CO2 the baby gets, the more sleepy the baby becomes. If the mom is a smoker, you actually double the distance from where the baby is will increase the same effects. So that's why we know, but the science tells us that if you're a baby boy, especially if you're a preterm baby, that you're a boy, and your mom is a smoker, you have 3 times the chance of dying in the first year of life, especially in the first trimester. So if you know someone that had a baby boy and she's a smoker, please tell her that. Please tell the dad that as well, because it's not only the mother who can be smoking, it's the dad as well. When we look at the district per se, there has been an increase in terms of the African American population, which is significant. It has been also, and when we talk about infant mortality, let me clarify something that is extremely important. We are talking about preventable death. When we talk about the Caucasian population and the Hispanic population, the number 1 factor for that are genetics or malformations. And that's essentially what you want from the science. You don't want that to happen, but if it's going to happen, something that you cannot prevent. But 75% of the infant mortality in the African American population in the district is preventable. And that's what we want to tackle. It's, if we can go, and those are the rates for 2012, the official rates for the African Americans, 12.4, the non-Hispanic white 2.5, the Hispanic 5.1, total 7.9. We will drill down more in terms of the data and explain that right now it's 6.6, but I cannot officially mention that, but I did. 6.6, sir. So, what we are looking is to reduce this to 5.0. That's the goal that we have, which is lower than the goal that we have for Healthy People 2020 for our nation, which is actually 6.0. But the actual rate that we want to do is eliminate all health disparities related to the African American population and the Hispanic population. When we look at the numbers and drill down the numbers in the district, 54% of the infant mortality in the African American population is secondary to health disparities. So we are doing 2 initiatives. First, the Stronger Together, that's essentially what we are celebrating today. In the next 3 months, we are going to be opening the Office of Health Equity, which is going to be working with all social determinants of health in the district. And so you understand social determinants of health, education, social factors, economic factors, transportation, the understanding of how the healthcare system works. We have been very successful in the district to bring people from the uninsured to either Medicaid or the health exchange to get an insurance. Now we have to help those patients navigate the system. You have to understand that only 1/3 of our patients right now in the district, insured or not insured, has seen a primary care provider the last 2 years. And think about that. When was the last time you saw your primary care doctor? So this is a real thing, and we want to change that. It's a public-private partnership. I will also add the academic part because the academia is working with us very closely on this. We will have quality metrics. The quality metrics and analytical work that we have been done is unique. I would say it's the first of its class in the entire nation, and that's why we can drill down in terms of the data and be able to tackle the issues affecting each one of the moms. This is a mom-centric, family-centric initiative. So this is strengthening the family unit, starting before the baby is conceived, all the way after the baby is born. And like the mayor mentioned, it's a continuum all the way to that kid graduates from college. So we are going to have advisory groups. Please, you are going to be receiving all information about that. The goal is close to 80% of the moms to be registered early for prenatal care, close to 80% to be not only registered, but to have continuous prenatal care at the normal visiting schedule. One of the questions that we have from the moms is, I miss an appointment today, my doctor will not see me for the next 4 weeks. So we are going to be doing something that the team from HASTA, the HIV team did, which was extremely successful, a leadership by the mayor as well. We dropped by 80% the incidence of HIV in the district related to IV drug use, and over 56% in terms of the rates of incidence in the district. And it's because they have the red carpet program. That means that within 72 hours of being diagnosed, you will have access to healthcare. We are going to do that for all our moms. And I mean all our moms and all our babies. We have to work for the smoke cessation, and we also have to work with the prenatal and postnatal care. In terms of and co-sleeping as well. So we are learning from the best practice resources around the nation. We have learned from over 40 states, over 50 cities, and we base that in the applicability of that science to our district. So these are some of the strategies. I will be sharing the slides with all of you. I just want to be able to not keep talking. So one of the quick questions is, do you want to become pregnant in the next year? We are going to be asking that question a lot, and then creating a plan of action for that mom. And those are the things that we are working, including the birthing facility report card. I'm an obstetrician and a gynecologist, so you understand. The system that I came, an infant death will be a crisis for the system. And maternal death will be a crisis for the system. And I think we had to bring that urgency to our providers. This is not the fault of the moms. This is a systemic fall. And so we have to bring the doctors. And this thing here, 17-hydroxyprogesterone, and my name has an X, I don't know why I cannot pronounce it. It's going to be one of the great tools, and we're working with healthcare finance to create an easier way that all our doctors offer that to the patients. 33% reduction on prematurity, again. So this is a great tool that we have. And One City Innovation, this is essentially how we are going to be working, stratifying the risk, identifying the risk factors early, social determinants of health, and not only talking that we're going to do something, but essentially working in teams. We are even going to have a PTSD team for moms that still were affected by infant mortality. And the last thing I wanted to mention, besides giving thanks to Kelly for, honestly, this has changed from the last time I was here to now. This even looks much more beautiful. But I had to thank Bibi, for the Deputy Mayor Otero, for all the support that she has provided to me and my team. I want to also thank my team. I mean, all the people from DOH, honestly, stand up for a second, because you deserve also all the work that. And we have, I mean, I'm not going to go through names, but Ryan, Karen, you have been doing exceptional work. I want to really congratulate. And then, of course, my boss, the leader, when I met him, so, you know, I have worked for 3 presidents, governors, WHO, Director General, and a lot of people with great leadership, and the mayor, I mean, he exudates leadership, but when you have the opportunity to sit down with a science person and talk about data, how we are going to fix this. The first time we met, it was supposed to be a 15-minute conversation, and it became like over 1 hour. A professor telling me essentially what has been happening and the science behind that and how we were going to be dealing with this. The 6.6 is a reflection of that leadership that he has. I want to say that. And we're going to be having a challenge that we're going to be starting very soon. It's going to be rattle for babies, rattle for moms. So when you see a mom or you see a baby that is one, like this, you rattle for them. It's like saying, God bless, you're going to be fine, I'm here for you as well. So we are going to be starting that. We are going to launch it in DC United game, but we're going to be challenging the mayor is going to be challenging governors and maybe the president of the United States. I'm going to be challenging all secretaries. So again, rattle for babies, rattle for moms. And thank you and God bless.
Hello, My name is Rebecca Brown, and I too would like to thank Mayor Gray, Dr. Garcia, the Department of Health, and the community groups represented here today that are striving to bring DC mothers and families the resources and services that we need to have healthy babies. As a mother to my beautiful 8-month-old son named Roman, I know firsthand how important it is to see my doctor regularly once you find out you're pregnant, and to take all of the advice that is given at the checkups. When I first found out that I was pregnant, I was scared and not sure what to do. I knew that I needed to schedule an appointment and to see a doctor so that I could learn all of the different things I needed to ensure that I had a healthy pregnancy. I was fortunate because my family was very supportive in encouraging me to get to my prenatal appointments, take my vitamins, and eat healthy, and make sure that I took good care of myself. But not every young mother has the support system that I had. So it is imperative for them to have access to resources and services. I cannot imagine my life without Roman, and once I learned of the Stronger Together initiative, I wanted to get the message out to other expectant moms. I truly believe that with the right support and resources, more DC moms will have the chance to enjoy motherhood as much as I do. I too am a part of Stronger Together. Thank you.
So I am Remy Shakir, and I am the CEO of Aegis Health Security, and we've had the pleasure of working in partnership with the district and primarily with Vincent Gray as our mayor, really providing the leadership and the political will to take on this challenge. And as you've said, we've made great improvements, and we still have a way to go. I think it's all feasible. I'm an optimist. One is we've had great partnership with the Department of Health, and I'd like to call out Karen Watts and Ryan and Chris Shorter, who have, one, programmatically really been willing to get their hands dirty and take another look at why have we stagnated in making improvements related to infant mortality, and then being willing to look at a public-private partnership. One is we've done it under the Clinton Global Initiative, which is a forum or a framework. It's a way of different partners being able to come together and mobilize for impact. And one thing that we've been able to benefit from are community partners, both from the corporate partners, the healthcare system, academia, associations, community-based organizations, faith-based organizations, being willing to come together and really stand together as a partnership and being able to do something very innovative that, in my opinion, really doesn't happen. And we're very proud to show this as a model for the nation as, one, this is how you can make the Affordable Care Act a success story, and this is how you can save babies, this is how you can save money, this is how you can enable the public health and the private sector to come together and work more effectively than they have historically. One thing that we've really benefited from are partners that historically haven't worked together and agencies that haven't historically talked together, being able to share the information, being able to look at data in a very different way in order to identify drivers and population factors, and then figure out how to better coordinate care. As Mayor Gray talked, the district is enviable of having the very high penetration for health insurance coverage by its citizens. But if those citizens aren't accessing or don't feel that they can access the care that is available to them, then this is how we can come together between the public and the private sector. And whether that's your local CVS or Walgreens, or if that's your Community of Hope clinic or your primary care provider, getting the mom into prenatal care early and consistently is a very feasible thing that we can do. And this is an invitation for additional partners to come and join this commitment. This is an invitation for corporate partners who would love to write a check. And then at the same time, this is a 5-year commitment. So this is a commitment where the leadership will evolve here in the district. The community is evolving. We have new citizens who are moving in every day. We have health systems that are transforming and are forced to be transforming. And we invite the different partners to be able to come together and be part of that conversation, whether that's in the technical advisory groups or writing a check. And then at the same time, understanding that this is a journey. We're birthing the baby today, and we would love to, in 1 year, be able to show that, yes, we are achieving our objectives, and more importantly, that we have a pathway of partners that are able to come and work together and be a model for the nation in terms of public-private partnerships, and a model for the nation of how the healthcare system can be a success story for the world in terms of we're the District of Columbia, the capital of the United States. It's a great country. and I think that, again, there's a huge opportunity for new partners to come together, and for the partners who are here today to be able to work together and make this a success story. And I'm honored to be able to be part of this journey with everybody. So.
Good afternoon. First, let me tell you how excited I am to be here, to be part of this, and to look out at the crowd, great-looking people who look healthy. And so the last time I was excited was a few weeks ago, early fall, September, coming back from vacation and finding out that Kaiser Permanente was going to be a part of this initiative. And knowing that the District of Columbia, its communities, its partners, was putting infant mortality rate at the top of their to-do list. So thank you. Kaiser Permanente, we believe in healthy communities, a healthy family, and that begins with great prenatal care. I can tell you we've been working on this for decades, and we are proud to say that we're #1 in the District of Columbia, in Maryland and Virginia, for providing great care to moms and infant. As everyone has said here, Dr. Garcia, we agree that a healthy outcome, healthy family, healthy community begins with early, timely prenatal care. That's right. And that it is continuous, and it is comprehensive, that it involves not just asking an individual prior to pregnancy, are you thinking about getting pregnant? But that you have your pharmacists, your well-dedicated physician, nurses, your health nutritionists, your health educators involved, and it continues to postpartum. And then it also involves that infant in the first year of life. We have created a delivery system from our DNA, our footprint in the community that we're in, to include timely prenatal care where mom comes in, she's stratified based on her risk. And then we put together the team, well-dedicated physicians and nurses that are coordinated, that are integrated, not siloed, not fragmented, not disjointed, but together, patients in the middle. And we use it all, we connect through a platform, a well-developed emergency electronic medical system. We look at the care and we make sure that breastfeeding is a part of the discussion, not just once at the beginning, but in the second trimester, in the third trimester. We have classes. We continue with that discussion immediately after delivery, 3 days after the patient is discharged, and also at 2 months and 6 months. We also vaccinate mom while pregnant, but we also contact with dad. We make sure he's vaccinated. Who's going to be active in the baby's life? We make sure they're vaccinated. And it's not just against pertussis, but the flu vaccination. And we repeat that every trimester, as well as in the postpartum days. We also have our pediatrician connected to our lactation specialists and their care team, where the baby has received all vaccinations by the first year of life. We've been cited on that. We're proud to say that. We're proud to share those best practices. So let me say again, we're here to join this effort. We're excited to be a part of this community. And we want you to know that anything that we can do to improve the community at large, we're there. We want to say to our families, to our members, to our patients, that there has to be a long-live you. Thank you, guys.
Good afternoon, everyone. So I'm not from the South, but I lived there for a while, and I appreciated a term that they say in Houston, all y'all. So I am very happy to be with all y'all together. We have a lot of work to do, but we can do it. I'd like to thank Mayor Gray and Dr. Garcia and the DC Department of Health, along with all the community groups, mothers and families such as Rebecca and Roman, corporate sponsors, and health organizations that are represented here today, who are collectively working to raise the awareness of this very important issue. So I'm an obstetrician, and in my role, I see firsthand the critical impact that prenatal care has on the mother and the child. The women that I have the pleasure of treating throughout their pregnancies come to me with a host of questions regarding nutrition and exercise, and also how to properly care for their infants when they return home from the hospital. And I can't stress enough how important education is in how the mothers, learn how to care for themselves and how to care for the babies. So this type, right, Roman, got it. So this type of ongoing education takes all of us, takes a collective effort of the community and of healthcare providers to ensure that mothers in the district receive the information and the resources that they need to have a healthy pregnancy, and not just a healthy pregnancy, but beyond pregnancy. In my experience as an obstetrician, I've encountered many young women who are unaware of the common causes and preventable causes of a challenging pregnancy. Factors that include proper nutrition and exercise throughout pregnancy, smoking cessation, and safe sleeping practices contribute greatly to the health of the mother and of the child, before pregnancy, during pregnancy, and after pregnancy. So, through our involvement in public and private partnership, we hope to show how all healthcare providers play a very important role in maternal and child health within our district. Infant mortality not only has a devastating impact to the family, but it impacts our whole community, the whole entire city. Together, we can successfully reduce the number of families that are affected by this devastating situation, infant mortality. We are stronger together. Thank you.
Good afternoon, everybody. My role today is really just to celebrate and to invite. I would first like to celebrate and commend Mayor Gray's team. Mayor Gray, for your leadership over the past 4 years and for your initiative today. Dr. Garcia, BB Otera, and as well as the Department of Health. Thank you for your leadership and vision and bringing attention to this critical issue. The other thing I'd like to do is to invite you to join Walmart as a partner of the Stronger Together campaign. We have a little bit of a different tact, I think. We're a retailer. What's our role in this? But what we're offering is an incentive for mothers to stick with the Stronger Together campaign. Come learn, come be serious, prepare for your for the birth of your healthy child. And so if you go through the program, you'll get a gift basket from Walmart that celebrates the birth of your new child. And so it's a very simple thing, and that's how we're playing our role. And there's lots of you in the business community and the individual philanthropy community that can contribute in a way that makes sense for the part that you play in this. And so we invite you to join us as a partner. Collectively, we can be successful in connecting moms to resources and engaging providers to help ensure a healthy pregnancy and a positive birthing experience. We are truly stronger together. A partnership between businesses, governments, nonprofits, and individuals is essential to solving infant mortality, an issue that has immeasurable personal impact on families and communities. Walmart is committed to playing our part in this, and we invite other businesses to join the effort. With the combined resources of public and private entities, we can help reduce preventable infant deaths in the District of Columbia. And I'm going to invite you further after this conference today to join Kelly and the Community of Hope for a tour of this new building in Ward 8. She'd like to show off what she's doing here. So as soon as this is over, for anybody who's interested in a tour, please meet in the lobby. Thank you very much.
All right, I want to thank all of our speakers, one for being with us today and for the passion that they've demonstrated, their commitment to being able to round this final turn. Again, I think we know the challenges that we face, and this seems imminently doable to me. There was a time 15 to 20 years ago when it was, boy, can we ever, really make serious, lasting progress? I think the time is over when we raise that question. It's now making sure that we get it done. And the commitments that you've heard today are, an important indication of how we move forward. So we'll be happy to answer any questions from the media. And Dr. Garcia, of course, will join me in doing that. Tom?
Mr. Mayor, thank you. I heard all the positive things that people said, but I didn't hear a good explanation of why the rate has gone up from 7.4 to 7.9.
Well,
I looked at the chart and I see that it's gone up and down over the last 5 or 6 years, 7 or 8 years, but I didn't hear an explanation for this past year.
well, I think you start by looking at the number of deaths. It went from 69 to 75, so there was 6. Probably some of the factors, you can talk about that if you want, Dr. Garcia, but I would suggest some of the factors that are the focal point of Stronger Together. One, not enough women getting into prenatal care during the first trimester. Not enough women staying the course through the entire 9 months. Far too many women, smoking, or frankly, it isn't just women smoking, because if they're in an environment where smoking is happening, they are smoking somebody else's smoke. So I would suggest those are the reasons, Tom, as well as the co-sleeping issue. We've lost in the last year probably, 6 to 8 kids because of co-sleeping, which again is a matter of education. I want to make it absolutely clear once again, this is not something that I would hold parents accountable for doing in a willful way. I don't have any doubt that this was a benevolent, loving thing that they did that resulted in a tragic consequence. So I would invite you to look at the focal point of the factors that will be focused on with this initiative as the reasons then why it has gone up and down. One could argue that it hasn't gone up in a material way, but it isn't so much whether it went up by 6. It's the fact that we still had 75 deaths. We still had 69 deaths. 2013, we had 61, which is a drop. But I don't focus on the fact that it went from 75 to 61. I focus on the fact that we had 61 deaths that still are preventable, and that's what we're going to focus on with this initiative.
Okay,
No, I agree 100%. He's my boss. So.
I got more than I can put on TV. I have a follow-up question, if I may. The Care First company is giving like less than $20,000 to the establishment of this building, according to the chart. Care First has nearly $1 billion, if not $1 billion surplus, and it's by law supposed to use some of that surplus to improve health care in the District of Columbia. Is there any progress on getting it to spend more of that surplus money on things like infant mortality and anything else you want to talk about?
Well, I know there's an ongoing dispute about whether the reserves are, there's more the reserves than there need to be, and it should be further spent down. That's a complicated issue, Tom, because when you look at the fact that they have members not only in the District of Columbia but in Maryland and Virginia, then and how much should go to what jurisdiction and for what purposes, that is still being discussed, still being negotiated, for want of a better way of putting it, through our Department of Insurance, Securities, and Banking, working with Care First. I will say this, that Care First has certainly invested in improving health care in the District of Columbia. So I wouldn't want to leave the impression that they haven't done things. Could they do more? Perhaps. Hopefully this issue will be settled sooner than later. And in the meantime, I don't have any doubt that Care First will continue to increase its investments in efforts like this. This would be a great way for them to become a partner and invest in the work that needs to be done here, the things that I talked about, like smoking cessation, as well as outreach to expectant moms to make sure that they get into, prenatal care and stay in it, for those 9 months. This was alluded to earlier. I guess it was Remy who mentioned it, but we talk about it a lot, and that is we have one of the highest levels of insurance coverage in the nation. Our adults, we have around 95, 96% of our adults now who are covered. We have the second highest level of coverage of any state in America. Only Massachusetts exceeds our coverage. And when it comes to children, we have the highest level of coverage. 97% of our children are covered. So it isn't just coverage, it's also access. That's why a place like this is so important, and why the clinics that Unity is providing on our behalf. Having an ambulatory healthcare system that is convenient, available, and known to people will make ultimately a huge impact on how we use the insurance resources that are available to us. The Affordable Care Act provides us an opportunity through navigation and other efforts to make sure that people who need to get connected with healthcare do that. We've often, and I'll stop after this, but we've often decried the fact that people go to emergency rooms. And for me, over time, where were they supposed to go? Because there wasn't much of anything else. But that's what we're building in this city, is a real ambulatory healthcare system that people can access. And I think ultimately it will be a big factor in making a difference in the infant mortality rate in the city.
And if I could just end my line of questioning, I appreciate it. Walmart spoke just a moment ago, and the sign is on the wall behind you. A lot of pregnant families would like to have a Walmart at Skyland.
So would a lot of the neighbors in, in that area
Out of
too.
office, it was your goal coming back from Las Vegas to make sure that part of the city was included, but there's still no announcement that will be built in Skyland, which is desperately needed in that part of town.
I'll ask Nina if she wants to respond to that, but I know that there is progress being made with the lease. That's the issue, the lease. I can't speak for Walmart, but I'm certainly very hopeful. I'm advocating and working as much as I possibly can to make that happen. We know we've had the groundbreaking, and by the way, I mentioned a few days ago that the demolition for Skyland will start on October 15th. So we're making progress, and we obviously want to be able to start as soon as we can on building a Walmart. Some may remember that Walmart actually was the only entity that stepped up to anchor at Skyland, and I was directly involved in that myself. I picked up the phone and called them and said, look, we need you there, and they agreed to do that. So I don't have any reason to think that this won't get done. I don't think that there's a fundamental disagreement between Walmart and the developer at this stage. I think that there are business points that are being negotiated still, but I have no reason to conclude at this stage that Walmart won't be a part of the development of Skyland.
Can we get that comment from Walmart? I mean, because for this issue today, there are lots of families, children, and parents who would love to be able to shop at Walmart and have what it's offered.
My statement's going to be short.
But can you go to the mic or it won't work?
Tom, we look forward to being at Skyland.
Doesn't mean you've said that for 7 or 8 months.
It takes time.
That's not an acceptable answer. Who needs somebody who wants to buy something there? But okay, I got no answer. I got it.
Well, you got an answer for me, and I know that there are negotiations that are ongoing. And I know that there's been progress on those negotiations, and I think it's down to a couple of points at this stage. That's why I say with some confidence I don't have any reason to think that Skyland will not include Walmart at the end of the day. Yeah.
Mr. Mayor, can you address the possibility of losing the $4 million in Healthy Start funding and its impact on this program and what it could mean?
Yeah, we certainly applied to continue the Healthy Start program. We had that grant. That grant actually started when I became the Director of Human Services. So we've had it for about 20 years. And it has made an enormous contribution to what we've tried to do with Healthy Start. So we obviously wish we had not lost the grant. In the time since we've been notified, our Deputy Mayor and Dr. Garcia have been working with HHS. And we've gotten now a no-cost extension of the grant through the end of this year. And we will be working to try to see if the outcome can be changed. I mentioned this on Friday. If we can change the outcome. We've made so much progress, and so much of it is attributable to the resources that we got through through HHS and the Healthy Start program. Now, if we were not successful in having any of those resources available to us after January 1st, it would require some adjustments in how we address, some of our, prenatal and neonatal care through the Department of Health. But it will not have a deleterious or untoward impact on this initiative. We'll be able to go forward with that. This is not just a question of dollars. This is a question of access and people understanding how to access, how to use their insurance resources. We have, again, a huge number of people who experience infant mortality, have insurance. We've got to be able to make sure that they understand how to effectively use it. We have a lot of Medicaid recipients in the city who we think we can improve outcomes by helping them understand and know that there are increasingly large numbers of healthcare facilities in their communities. So yes, if you ask me if I wish we hadn't lost the grant, absolutely. But it in no way has a devastating impact on our ability to do what it is we've set out to do with this.
And the services are not going to be affected. The services will not be affected. Regardless, if right now they're reviewing the grant again, okay? And we have been working, Bibi, herself, myself, we have talked with the leadership at HHS and also at HRSA. This is something as part of the Affordable Care Act, the transitions that goes into the community in terms of the successes that we have in the district. Sometimes the outcomes with federal grants is not what we expect. So, but the services to our patients will not be affected. And I promise that because we are going to be working with our community partners. We're going to be working with all the different segments of our communities to make sure that home visiting and education will continue in the district. It might not be provided by the Department of Health. I hope that review comes back positive for us, but we are working right now to make sure that those services will not be affected.
But it could mean a loss of over 30 jobs, correct, within the Department of Health?
Well, yeah, but I don't think this is about jobs. Of course, jobs are important. This is about being able to make sure the services are provided to pregnant women. That's the bottom line.
Mike has the last question.
Can you put some more explanation on that? I mean, 38 people have been told they're going to be laid off. You're saying it's not going to have a deleterious effect, but can you explain more specifically how those services are going to be?
You know what? I don't want to turn this into a discussion about people losing their jobs. That just puts a negative spin on this, Mike. And I know you didn't start this discussion; it was started back here. But I don't want to wake up tomorrow and see the headline being 38 people lose their jobs, Healthy Start imperiled in the District of Columbia, women won't get prenatal care anymore. That's the kind of stuff that is so dispiriting when you do this. This is a positive experience today that will advance our efforts to be able to prevent infant mortality in the District of Columbia. So the media that are here, I would ask you to please not do that.
Mr. Mayor, the question I'm asking you is to give some assurance that the services and that those employees are going to continue, and give me some explanation of how that will happen.
I already told you yesterday, and I repeated it again. I'm giving my word, and I have never broken it. We are going to continue providing the services. We are going to amplify the services. That's why we have over 40 partners right now. We are close to 50 right now. And this is even ways that we have not even done before. We are right now talking with a partner that is going to provide 2 mobile vans. We're going to be bringing education to the homes. We are going to be bringing the services to the neighborhood supermarket, neighborhood pharmacy. So this is in a way that it has not been seen before in the district. Again, this is about Roman. This is not about DOH. This is about Roman and the babies around here in the district. So.
let me say one more thing, and that is, I would hope that those that report on this would connect the dots between special programs like Healthy Start and the Affordable Care Act. That's one of the reasons why the Affordable Care Act was adopted in the first place, to open the door to health care to people who heretofore, for a variety of reasons, didn't have that. Now, I believe there should be a transition plan at the very least for this program. But I don't have any illusions about the fact that ultimately where you want to wind up is not a bunch of special programs, but the access to health care for, in this instance, for women who are pregnant so that they can be able to have healthy babies. That's what the Affordable Care Act is about. Being able to concentrate in one arena, health care for people. We have a lot of health care services now in the District of Columbia. We have a lot of health care coverage. We've just got to make the best use of that. Do I believe that there should be a transition for Healthy Start to that? Absolutely, and that's one of the arguments that we're making.
Mr. Mayor, the entire country is now running scared about this Ebola presence in Texas for the first time.
Nah, we're not, you can talk about that offline. I'm not going to get off on Ebola. This is an important issue, but this is about infant mortality today. So thank you all very much.